And good morning. Welcome to Deuk Spine Institute live stream of spine surgery. Our patient comes to us from Indiana, and he had a family member, who actually came here some time ago, who had surgery and did very well. Shot. And I'm just trying to get into his spine. AP. Quick. Shot. All right. One more. Lateral. I'm going to have to go just a tiny bit further to the midline. Shot. 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 All right. So folks, very thick neck, a lot of soft tissue. Dr. Berndes has done a phenomenal job of getting me as close to soft muscles, but I am going to have to try and one more time reposition this. So give me just a minute. This is the displacement step of the surgery where I have to displace the soft tissues over. And if you have questions, just give the question to Henry, and we'll do our best to answer them. Okay? Other than that, I'm going to displace his soft tissues and try once again to access 6-7. Shot. 2, 3, 4, 5, 6, 7. Need to be a little bit lower. Shot. Shot AP. Quick AP. Quick shot. Right now. All right, perfect. Lateral. That looks good. Shot. This is the hardest part of the surgery. Shot. Getting into 6-7. Shot. All right. Let's hope that's it. AP. So I pushed as far as I could. I got over far enough, which is good. Let's just see if we ended up in a good spot. Perfect spot right there, right on the spinous process. So we're in the center. The staples in the back of the neck are from his rhizotomy, his Deuk plasma rhizotomy we already did. All right, so we are at 2. Let's count. 2, 3, 4, 5, 6, 7. Shot. All right, so what's happening in your area of the world? Florida is having a cold spell, actually record cold spell. I think it's been about 15 years since we've had this kind of cold. Shot. And shot. But not as bad as the rest of the country. It's even colder. Hold on. I'm going to place this. Before you do that, I would like to, let's have the stylus. I would like to get into 4-5. I think it may be good to do that now while we're still relaxed.
You want a short leader?
Now, Henry, let's show people how disc injuries like a herniated disc or bulging disc can actually cause so much pain. Shot in the neck.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Lateral. We'll come back. We're now gaining access to C4-5. Shot. Shot. Perfect. All right, AP, Coker. Take it easy with that other needle. Very difficult neck to access the disc. It looks really good there. I'm happy with that. So I'm going to embed 4-5 a little deeper, and then we're going to start with 6-7. Shot. Shot. Might as well do our discogram at 4-5. 4-5 is pretty collapsed, degenerated. What happens is you get an injury to the back wall of the disc called an annular tear, posterior annular tear, herniation shot. And then you get that tear. Show us the tear at 4-5, Jordan, in the back of the disc. That whole line right there where he's outlining is the annular tear. Shot. The herniation goes right through that tear out the back. And that tear is the source of neck pain, headaches, even arm symptoms called cervical brachial pain, cervical radiculopathy, cervical radiculitis. All of those abnormalities are inherent to disc injuries and inflammation. Just leave it for a second. Shot. Let's see, because it's bent. Shot. All right, if you have questions, I'll take them.
Yes, we have a question coming from Matthew on YouTube.
Hello, Matthew. Welcome. Shot.
Saying, good morning, Dr. Deuk. We recently had a MRI review for my neck. I've undergone an artificial disc replacement, which I regret. We determined my pain was coming from my facet joints on both sides. I also hope to have another MRI review due to a bulging/herniated disc in my lumbar spine. Since I live in Arkansas, would it be possible to take care of both of these areas within one 3 to 4 day trip?
100%. We can do it. As a matter of fact, we can do your facets and your lower back treatment the same time. Same surgery, same time. So that will save you a lot of time and risk. Obviously, you don't want to take the risk of anesthesia more than once if you can avoid it, and we can avoid it. Shot. So just do your lumbar review with me, and then we'll have a plan for your lumbar. We can do your cervical and lumbar same day, same time. That way you only need to be here for 3 days. So, folks, our success rate at curing back pain from a disc injury with the Deuk laser disc repair, and this is the only place in the world you can get this surgery done, is 99.6%. That means if you ask our patients that had pain in their back or neck that was coming from a disc herniation or disc degeneration, disc bulge, protruded disc, extruded disc, ruptured disc, any of those disc injuries, they're all the same, by the way. They all cause pain the same way, through inflammation in the back of the disc in the annular tear. We're just going to get another quick x-ray from an AP view. Shot. And the Deuk laser disc repair is the most successful treatment in the world. Jordan, show the audience on that AP view the annular tear in the back of the disc at 6-7 on both sides, but you can see the right side where he's pointing to. That dye is wrapping around the C7 nerve root. That's the C7 nerve root there. You guys are seeing it in the foramen as it's going out. And then on the left side you can see it's not as bad. But the tears are bad on both sides, and we're going to fix the tears on both sides. That's what this surgery is so amazing. Minimally invasive, but also maximally effective. And immediate recovery, just an hour to recover. Because we got the world's best anesthesiologist right here, Dr. Berndes. All right, the dilator is at the back of the disc. I wouldn't say if it wasn't true, Dr. Berndes, you know that. You guys see how much blood we've off. That's about 5 drops, not even a nosebleed. That's not even a stub my toe on asphalt when you're a kid running around the streets, which I've done several times, by the way. Have you ever done that? Yeah? Right? I mean, how many kids today know that feeling of tearing the top of their toe off from running on the street barefoot? Like, that was my generation, your generation. We grew up playing outdoors. I mean, we had a great time. What a childhood we had. Just running around with our friends, bikes, skateboards, climbing trees, rock fights, all that stuff. All right. Henry, we have any questions from our audience?
No current questions, so we do. We have a comment coming from Kelly on YouTube
Hi, Kelly.
saying, Matthew, Dr. Deuk did my first. Oh, he's replying to Matthew saying, Dr. Deuk did my facets, disc in neck, L4 herniation, and my SI joints. Dr. Deuk and his staff are amazing.
Oh, thank you so much. I appreciate it. We love having our patients from the past come in and share how they're doing with us. And, you know, it's great to hear. Very happy that you're doing so well. All right, we are just at the back of this 6-7 disc. And I always choose the hardest disc to do first. I like to get the hard one out of the way. I don't know what it is, but it's just in my nature to do it that way. I think there's probably a safety benefit for the patient to get the hard one done first. But because his discs that we're fixing are separated by a disc that is not causing any symptoms, you see this, we have to have two separate incisions. So the first one is at 6-7. The second one is higher up at 4-5. We're leaving the number 5-6 disc alone. It doesn't need to be repaired. But we're fixing the two separated by a normal. Now, one of the biggest problems with invasive spine surgery like ACDF fusion or PCDF is something called adjacent segment disease. And what it means is once the surgeon treats the disc that you're having surgery for, then they fuse it or put an artificial disc in there, you're going to end up having problems at the adjacent segments, which are the disc above or below. With Deuk laser disc repair, the surgery you're watching right now, we don't have adjacent segment disease. We've never had a single case of adjacent segment disease. And by the way, this is Deuk laser disc repair number 2,740. Is that correct, Henry?
Yes, exactly.
So we're keeping track of how many we've done. We've done 2,740 in 20 years. I started doing these surgeries 20 years ago. And our average elimination of neck pain, arm symptoms is 99.6%. And that's permanent, by the way, folks, not temporary, it's permanent. Once you have this done, we don't expect you to ever get anything else done again. Now, some people will re-herniate 1%, but it's only typically when they do things they're not supposed to do afterwards, like heavy lifting or boxing, jiu-jitsu, martial arts, things like that. All right, you guys see this? This is amazing. We're seeing the tear in the wall in the back of the disc. The blue stuff is the dye we injected. That's called the Deuk spine dye. And this is the herniation. It dyes to the herniation. The dye stains the herniation blue. All right. Well, I will announce it to you all because it's, I think, something of interest. We have a lot of golfers that are our patients. And Deuk Spine Institute is now sponsoring a young golfer. He's a young amateur golfer. He is competing in the amateur tour in the United States. And his name is Joey Stills. Joey Stills. And Henry, maybe you can put a link to his page.
Exactly what I was doing, correct.
Yeah, thanks for doing that.
Not a word.
So Joey Stills is based out of Orlando, Florida, where we are. And young kid, really nice kid, very bright, very talented. I think he's going to be the next Tiger Woods. So we were fortunate enough to secure a sponsorship deal for Joey Stills. And he will be starting competition in February. And he'll be going around to different courses, playing, competing as a Deuk Spine Institute sponsored golfer. So keep an eye out for Joey's career. We're also going to have some videos done with Joey here, with Henry on the golf course and in the office, so we can put that out there for everyone to see and enjoy. All right, any questions from our audience?
Yes, we have a question coming from Donetta on YouTube.
Hi, Donetta. Before I take Donetta's question, I just want to point out, folks, the laser is the glass tube at the top at 12 o'clock. You guys see it there? That's
Yes, we do.
half of a millimeter wide, half millimeter. That's how precise our laser spine surgery is, half a millimeter. But we also can zap away tissue that is extremely precise at basically 1/20th of a millimeter. So take a millimeter and cut it into 20 pieces. That is so small, but the laser has the ability to remove tissue at basically 1/20th of a millimeter off of the tip of that glass right there. Okay. Now, what a lot of you don't see is there's a machine here in the operating room. I use a holmium YAG laser. I've done all my surgeries, all 2,740 laser surgeries here at Deuk Spine Institute with a holmium YAG laser because it's the safest and the best. Okay. Other types of lasers include CO2 laser, which I think is dangerous. I don't use it. It's not as effective. This is the most perfect laser. It's very expensive, unfortunately, to buy these machines. The new ones today are costing $200,000 plus per unit, per machine. And the cost of doing these procedures has gone up, unfortunately, over the years. All right, this is all bone spur right there. You guys see the bone spur and see how nicely the laser removes bone spur. I'll
Yes,
take my question.
Next question from Donetta asking, what are his limits while he recovers?
Yeah, great question, Dana. So the only restrictions for the laser patients at Deuk Spine Institute are lifting. We don't want our patients lifting over 40 pounds for the first year while the disc seals itself and heals. So this gap back here, the tear, will seal itself. The body will seal it now that I've cleaned out the herniation and the bone spur. But your body cannot seal this with the herniation and bone spur there. So you must remove it with the laser in order for your body to heal it. And that's what we're doing with this surgery. You guys are watching it happen in real time. By the way, Luis, this laser is perfect. I mean, the scope is perfect. I apologize. And the laser is perfect as well. So we got great visibility. I love this visibility. Luis is in charge and Nikki in charge of maintaining our scopes. And my gosh, look at that view. It's just unbelievable. You guys are literally looking at 1/2 millimeter tube. So look at all those bone spurs and stuff. It's less than 1/2 millimeter. You're talking about 1/10 of a millimeter. Very easy to see, 1/10 of a millimeter with this scope. Now, I've said it before, in my opinion, this is the most advanced laser spine surgery available in the world. And we're doing future spine surgery right here at Deuk Spine Institute. Now, this upsets a lot of people, but not patients. It upsets other people, like neurosurgeons that don't do these types of surgeries. They get angry that they're not doing these surgeries. They don't know how to do them, and they've never been trained to do them. And by the way, they're upset because, well, what they do is fusions and laminectomies. Those surgeries are going to go the way of the dodo, if you understand that phrase. It means they're going to be extinct one day. This procedure you're watching right now will make them extinct. That's my opinion. Because those procedures are invasive, dangerous, harmful to the patient, and they have terrible results compared to this surgery you're watching right now. Okay? It's all about outcomes. That's what drives medicine, is taking good care of patients and giving the patient the best result humanly possible, or robotically possible, if you will. And this surgery you're watching right now, in my experience of doing 1,000 ACDFs and artificial discs in my career, is that this surgery has far better results than ACDF and artificial disc in terms of resolution of symptoms and lack of complications with this procedure. Also, our patients don't take narcotic painkillers after surgery. If you have an ACDF fusion or a laminectomy or foraminotomy, you're going to be on narcotics. So that's just a fact. Hector,
Yes.
how are you?
Good.
We are streaming live. You want to talk to Dr. Berndes or? All right. So I'll take the questions.
Next one from, forgive me if I mispronounce this name, is Amit, A-M-I-T, on YouTube.
Hello, Amit. Welcome to our live stream. Thank you for joining us.
asking, which spine scope are you using?
I'm using the Wolf endoscopic scope. Wolf, made by Richard Wolf. It is FDA approved in the United States, as is all of our equipment, right, Luis? We don't use anything that is not FDA approved. Flip it. All right, we're just about done with this here disc. I've got just a little more. Look at this piece of herniation right there. Now, I have to chop it off. It's scarred down to the back of the disc. Look at that thing. And it's getting calcified, so it's heavy. It doesn't want to leave. So I'm going to have to incentivize it to leave. Look how the laser just breaks it up so easily, right, into little pieces. Even those little pieces don't want to float out. They're so heavy, so dense, because they have a lot of calcium on them. All right. Any other questions? Here's the last of the herniation, and then we're going to move on to the next disc.
No current questions. We just have a comment from Matthew saying that's great news. I've had back and neck pain and headaches since yesterday afternoon.
What? Yesterday afternoon. What happened yesterday afternoon, Matthew? Something you want to tell us about?
Until he comments, apart from that, no current questions.
Well, Henry, since we're comparing the Deuk laser disc repair to other types of invasive spine surgery, why don't we show the audience why we think this is the best procedure available for them?
Of course.
I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I'm here to talk to you today about neck pain and its common treatments. Neck pain has different causes. The most common cause of neck pain is a herniated disc. Herniated discs account for about 85% of chronic neck pain. The second most common cause of neck pain that's chronic is the facet joints. There are facet joints on both sides of the spine, left and right. There is one facet joint for every disc. Facet joint pain requires a different kind of treatment targeted at the facet joint itself. For disc pain, which accounts for 85% of neck pain, the best treatment in the world is the Deuk laser disc repair. It is the most advanced treatment that is the safest and has the highest chance of successfully eliminating symptoms. Let's talk for a moment about what's important for patients who are considering treatment for neck pain coming from an injured or damaged disc in their spine. The most important thing for patients, number one, is getting rid of their symptoms. The type of symptoms that disc herniations or disc injuries can cause include neck pain, headaches, and symptoms down the arm, such as weakness, numbness, tingling, or even pain shooting from the neck down into the arm. The symptoms of neck pain include disc herniations, which are the most common cause, and patients want those symptoms gone. That is their number one priority and goal. The second most important goal for most patients is to avoid a complication from the treatment. Medical treatments do have complications, and the more invasive the treatment, the more likely a complication will occur. Complications from surgery, for example, can include blood clots, pneumonia, heart attack, infection, failure of the spine to heal properly after surgery. There can be implant migration or implant failure, adjacent segment disease, and vascular complications such as injury to the blood vessels or nerves in the neck, including the trachea and esophagus. Nobody wants a complication from spine surgery on their neck, so less invasive is typically going to be a better option to avoid those complications. The third thing patients really want when they're looking at treatment options for curing their neck pain is they want a quick recovery. People want to get back to a normal life as quickly as possible. They want to go back to their activities, they want to be active, they want to play sports, and they want to go back to work. And finally, the next thing to consider is long-term results. For example, if you have a treatment today and it works, how long will that treatment last, and will it create additional problems down the road for you? Treatments like spinal fusion that are invasive typically result in the need for additional treatments such as pain management, physical therapy, and possibly additional surgery. We're going to look at each of these individually and go through each of these options individually. So we're going to start with more invasive treatments that are typically recommended for patients with herniated discs or degenerated discs in their neck. The most common treatment recommended around the world is anterior cervical discectomy and fusion. That is a surgical treatment where the entire disc is removed surgically through a large incision that is very risky. There's bleeding associated and risk of injury to surrounding structures such as the esophagus, trachea, and blood vessels in your neck. Complications are very common with this type of surgery. The complication rate is accepted at 48%, which is a very high number. So if you're considering ACDF or anterior cervical decompression and fusion, you are looking at a very high complication rate. The success rate of this surgery at eliminating neck pain is very low. It's somewhere on the order of 25%. That is the generally accepted success rate at eliminating neck pain. An additional treatment that you can consider is artificial discs. Artificial discs are very similar to ACDF. The difference is instead of fusing two bones together with a metal plate and a cage, we're actually putting in a mobile disc made out of metal and plastic that moves. The problem with the movement is that these discs do pop out of the disc space. Over time, they can fail. They can cause collapse of the vertebral body above and below through fracturing, especially in patients with weak bones such as osteopenia or osteoporosis. Those types of patients are at high risk for complications from both ACDF and artificial discs. Another complication from artificial discs is that you can develop facet joint pain and adjacent segment disease. Very common with artificial discs and fusion, and they typically have the same rate of adjacent segment disease. There's also a long recovery associated with both ACDF and artificial discs. Recovery can take months to years, if recovery even happens at all. There's tremendous scarring in the wound associated with ACDF and artificial discs. Lots of scar tissue, lots of pain, and lots of problems after these surgeries that are invasive. Alternative treatment would be to go in the back of the neck and do a cervical laminectomy and fusion. Again, large incision, high chance of complications, very long recovery, taking years to recover. All three of these types of surgeries, ACDF, artificial discs, and posterior cervical laminectomy and fusion, require the use of postoperative narcotic painkillers. Narcotic painkillers are opioids. They are dangerous. People get addicted to them, they can be abused, and people can overdose. It's easy to overdose on narcotics because you want to keep taking them to treat the severe pain you're going to have after these invasive type surgeries. The severe pain can last weeks or even months, and the addiction can happen very quickly. Let's move into less invasive. They stick a needle into your spine and inject a steroid medicine to reduce inflammation. While this treatment can be effective at temporarily giving you relief for a few days or even a few weeks, the pain always comes back from a herniated disc because the source of pain is never being treated. The annular tear and inflammation within the annular tear is not treated by an epidural steroid injection. The steroid goes throughout your body and causes systemic side effects such as high blood pressure, elevated blood sugar. In patients with diabetes, this could put your sugar up into the 300s and 400s, which is very dangerous for patients. So steroids should be avoided as much as possible. Next, let's turn to spinal cord stimulators. The problem with spinal cord stimulators is they are highly invasive and they are frequently put into patients by untrained doctors who are not surgeons. These doctors are typically pain management specialists, and they're putting these stimulators in patients not because they can cure your pain, but because it's another treatment that they have up their sleeves. These treatments with stimulators pay these doctors obscene amounts of money. The profit for the doctor can be in the tens of thousands of dollars. Avoid spinal cord stimulators. They do not work, they're dangerous, they put you at tremendous risk, and in the end, basically you're taking this device, sticking it on top of your spinal cord and putting a pacemaker under your skin that you're gonna have to live with for the rest of your life. They cause scar tissue and they frequently migrate and get out of position. Next, we're going to talk about physical therapy. While physical therapy has many benefits, such as keeping you toned and fit while you're struggling through the pain and trying to stay mobile, but physical therapy will never, ever cure pain in the neck from a herniated disc. It will just try to keep you active and from getting more and more sedentary and developing deconditioning of your muscles because you're sitting around because you have neck pain all the time. Finally, let's talk about the Deuk laser disc repair. The Deuk laser disc repair is the solution for neck pain. If you have a herniated, bulging disc, extruded, ruptured disc, protruded disc, or degenerated disc, the Deuk laser disc repair works by minimally invasive treatment, going to the back of the disc where the problem is coming from. This is the tear in the back of the disc that has inflammation, and using a laser that is extremely precise. The laser fiber itself is 0.5 millimeter or half a millimeter wide, and the endoscope allows me to see 1/20th of a millimeter. I can directly see the nerves and spinal cord. It is an extremely safe treatment. As far as results go, the Deuk laser disc repair has the highest success rate of all the treatments we've discussed so far. We have a 99% cure rate of neck pain coming from herniated discs, and the Deuk laser disc repair has 0 surgical complications to date. Our patients have an immediate recovery. In 1 hour, they're leaving our facility and they're going back to their hotel room. They usually drive themselves in the next morning for a quick checkup, and then it's back to a normal life. Well, I've enjoyed talking to you, and thanks for taking the time to listen to our video. I'm Dr. Ara Deukmedjian. We'll also find this on our podcast at Deuk Spine Institute Podcast. Thank you. All right, welcome back. We were just talking about boxing and how Henry has just informed me that apparently Floyd Mayweather will be fighting Mike Tyson, with another fixed fight, I'm sure. But what drives me crazy is that people actually pay money to watch these fights.
Yeah.
I mean,
It's going to happen in the spring, that fight.
mm-hmm.
Doesn't say when.
Where are they going to fight? Did they say?
Africa.
I knew it.
Yeah.
Probably Saudi Arabia or something, right?
Yeah, it's going to be an exhibition match. Won't affect professional records.
Yeah, they have to do it in Africa because in America they wouldn't allow that garbage to happen, right?
Exactly.
Supposedly.
Yeah.
Anyway. All right, any questions from our audience?
Yes, we have a few questions.
We
and
are
a
almost
comment.
done, by the way. We've got about 5 minutes left. This is a bit harder before I take the question because the scope is being forced up by the anatomy of the disc, but I'm able to still get back here and treat the herniation, which is good news. Sorry, we'll take it.
This first comment is coming from Amit on YouTube when he said, I am myself a neurosurgeon, regular watching your videos, good for learning new things.
Ah, thank you. Very, very kind of you. Where do you practice?
I will respond to that once he comments. Until then, we have another question from AAKK on YouTube asking, how far into the lateral recess as well as into the foramen do you laser in the cervical spine? Do you ever see symptomatic bone spurs in the cervical foramen?
Yeah, I can go all the way into the foramen and laser, and I do it all the time. And that's where there's a lot of compression of the nerve root, like right here. You see this? That's a herniation in the foramen on the nerve root, right there, that blue ribbon. That is the herniation, okay? I've already removed most of it. So we are in the foramen. You can see the lateral border of the dura right there in the center of your field, and I'm going out into the foramen. Now this is particularly difficult for me because the anatomy is forcing, you can see my tube is being forced up towards the end plate of C4, right? That's the inferior end plate of 4. And here is some bone spur. This is foraminal spur right there. I don't need to get rid of it because the nerve root is not being compressed by it. But this stuff right here, I'm trying to get more towards the end plate of 5. This is the foramen. We are in the foramen with the laser. You can see the lateral border of the dura right around here, and then that's nerve root down there. But I don't see any more compression. There's nothing pinching the nerve. And I've gotten all the free fragments out of the foramen. But that's the nerve root right down there below that ribbon of tissue. This is scar tissue from chronic inflammation. We're going to take one more look and we're done. But I appreciate the comments from our doctors. We have a lot of doctors watching. I will say this, that our procedure is really the best in my opinion because I used to do fusions, laminectomies, ACDF, everything. I've done it all. Part of my training, I trained at the top neurosurgery training program in the world at the time, University of Florida in Gainesville. and under Dr. Roten. And the point is, these neurosurgeons, they don't like me very much because this surgery does not use implants. We don't use biologics. We don't use implants. It is natural repair of the disc. And I learned the transdiscal cervical endoscopic treatment from Dr. Seng-Ho Lee, Dr. Gun Choi from Woodall Hospital in Korea. He was the pioneer that I believe he was the first one to do this surgery and in the cervical spine. So I learned the lumbar from Dr. Royton and Dr. Young and Dr. Knight in England, who's retired. I learned it also from Dr. Seng-Ho Lee and Dr. Gun Choi. But the cervical was only being done 20 years ago, cervical endoscopic, by Dr. Seng-Ho Lee in Korea. He was the first one. And I learned directly from him how to do the endoscopic part. But the laser part is my own invention, the debridement of the annular tear. And I've been doing it for 20 years. It's been peer-reviewed and published, and I've presented it at meetings all around the world, including Hong Kong. I even did it in, I want to say, Saudi Arabia a couple of years ago. I presented to the Saudi Arabian neurosurgeons. Was it Saudi Arabia or maybe it was the UAE? I need just a few seconds left. Honestly, it was I don't remember exactly, but it was one of the Middle East neurosurgical societies. All right, we're done. I've gotten all the herniation, I've debrided the tear, and we have fixed 2 discs, C4-C5, C6-C7. Not an easy case because the patient's neck is very thick, but for the people out there watching, this is a little bit of antibiotics. Specifically, I use dilute betadine. It's the best topical in my opinion. We used to use bacitracin, but they found some issues. In the United States, they've sort of stopped using bacitracin, 50,000 units per liter. There it is. We've had no bleeding, just a few drops. And you can see this patient has 2 incisions. There's one. That was 6-7. 4 millimeters. That's all. Here's your ruler. Let me have it. You can see how small these incisions are. This is not ACDF. Okay, you can see just a few millimeter incision. All right, I'm just holding pressure for venous bleeding. And there you have it. You can see the Adam's apple right there, the 2 incisions, 4 millimeters each. It looks like he was attacked by a vampire. That's Jordan, you know. You got your fangs in there, Jordan? All right. Any questions before we wrap this surgery up?
Yes, the final 2 questions coming, both are from PNX Skate on YouTube.
Hello there.
Asking, what is the non-blue stuff, and does that issue at C4-C5 cause rhomboid pain?
That's a great question. So the blue stuff is our dye that we use. It's a vital dye. It only stains one thing in the spine, and that is degenerated nucleus pulposus. It will not stain normal nucleus. It will not stain annulus. It will not stain inflammatory tissue or bone or cartilage. It only stains degenerated nucleus pulposus, basically the herniated disc. And can you get pain in the rhomboids? Yes, you can. But if you're wondering what's causing my pain, the best thing you can do is get us your DICOM MRI images, the MRI images, send them to Deuk Spine Institute through our website. We have a portal. And do a free consultation with me, yours truly. We don't charge you money for it. It's free. It's free for anyone in the world who wants to know what's causing their pain. I'll give you a diagnosis, and we'll also recommend a treatment. Anything else?
No current questions.
Thanks so much for joining us. Please join us later on today. We'll be doing a lumbar Deuk laser disc repair. Have a nice day.
here with my patient who traveled from California, Northern California. He had a herniated disc at C5-6. It was a small disc bulge. He was told by the doctors in California that he should just live with the pain, give it time, and eventually he'll need a fusion. Is that right?
That is correct. I was told that within 5 years I would be needing surgery. So basically what they were saying, live with pain for 5 more years and then we'll do something about it. One of the things that I've seen a lot of the videos is testimonials, and I will always say, this doctor sounds too good to be true. And actually it is true. I appreciate you, doctor. I really think that it is really nice procedure, and the staff here is really nice. They're always very friendly and kind to get you through the process, because when you get told so many times that that's your new life, it's kind of, you're always thinking, is really the way I want to live? If I'm going to live a lot of years, why wait with pain? You know, you need to do something different. And always, whenever you see videos, you're always a little sketchy and saying, maybe it's not true. Maybe this is not what it is really saying. But today, when I felt with no numbness and no pain on the neck and just going through the process, I really been blessed. I'll be flying to California today. I honestly can't say much. You know, it's a miracle. Whenever I heard the testimonials, they say you're a tool for God. It actually seems like that's the way it is. It's a miracle through you. God works through you, and it's awesome to feel better, you know?
I'm so happy for you and your lovely wife who's here with you. You can see you had a tiny little incision. You had the Deuk laser disc repair for your herniated disc. You can see we were in there with the laser, cleaning out that foramen on the right side where the nerve was being pinched. There were a lot of pieces of herniation in there. And the laser cleaned them all out, and your surgery went perfect, and here you are less than 24 hours later. Feeling good, huh?
Well,
With
yeah.
a smile on your face. That's what I like to see.
You know, it's a smile of happiness. It's a smile of joy, you know, that it is doable. And I think no one should be able to be living with pain. I was so happy to see testimonials when they used to say, well, the one regret I have is not going in earlier and living 18, 20 years with pain. For me, it's been 3 years since July of 2020. It's been miserable because I've been with pain. And I've been told by doctors, let's just take time. I did all kinds of physical therapy, acupuncture, you name it, everything that's out there, and nothing seemed to help. And today, with 1 day of getting something really that's gonna be for life, it's amazing. It's a smile of joy, you know? If you are going through this trouble, don't hesitate on sending your MRI. When I did it, I sent my MRI for free review, and my answer was, yes, you are a candidate. Here I am today, flying back with literally no pain on my neck and no numbness on my hand, which I miss that. That's awesome.
It's wonderful. Now, what is your native tongue? What is your native language?
It's Spanish.
Are you from Mexico originally?
Guadalajara, Jalisco, Mexico.
Guadalajara.
Yes.
One of my favorite songs. Can you tell them in your native tongue how you feel?
Yeah. Quisiera decirles que si están teniendo problemas con una hernia en su cuerpo, manden su MRI, es gratis y les van a dar un resultado, una verificación si ustedes son candidatos. No vivan con dolor, porque el dolor les va a causar toda la vida, y los doctores allá afuera les dicen que no hay solución, pero las soluciones existen, simplemente las tienes que buscar y creer, tener fe que tú vas a estar mejor. Si Dios te mandó a este mundo es para que vivas bien, no para que vivas con dolor. Así que te recomiendo que por favor tomes esto en serio, hagas ese paso de mandar tu MRI gratis y habla ya sea con quien tengas que hablar para que ellos te empiecen a guiar y te digan qué es el siguiente paso que tienes que tomar. Así que una recomendación con Dr. Deuk. Muchas gracias.
Muchas gracias, amigo. And Feliz Navidad.
Feliz Navidad. Gracias.
Safe travels, my friend. Thank you so much for sharing.